Good evening, ladies and gentlemen. I'm your host and tutor, Annalise Garrison. This is a re-upload of a very good ECG strip presentation that I did several years ago. I'm re-uploading it because the NCLEX has changed. The next generation NCLEX has changed the way it asks questions about the ECG strips, but the reading of the ECG strips is still the same. We have been reading ECG strips since 1888 is when it first started, and then it gained a little more popularity, or whatever you want to call it, in 1903. So reading the ECG strip still remains the same, and that is what I am presenting to you today. It's also important for you to know that I am now a retired nurse, but I am still tutoring for the NCLEX. So let's get started. For the purpose of NCLEX strip identification, I want you to focus on the P wave, the R or the peak, as you can see in this picture right here. This will help us to determine the rate and the rhythm. I want you to focus on these small boxes. Each small box, 5 of these small boxes make up one big box. I'll get into that. So focus on the P wave, the R wave, the rhythm, which is the small box versus the big box in the strip, and at times the S wave. This is all I want you to focus on when identifying the NCLEX cardiac strip. Let's talk about identifying the rhythm. You know if something is bradycardia too slow or tachycardia too fast, but how do you identify the rhythm? You identify the rate by counting the R's, right? The number of R's. But how do you identify the rhythm? And the rhythm you identify by counting the small boxes on the cardiac strip or the big box on the cardiac strip. So the way you identify the rhythm is you have to look. Each small box is 0.4 seconds in length. Notice, if you cannot see this, I want you to stop the video or put it on the big screen or on your phone or put it on your TV, right? I drew this myself because everything you see on the internet, any strip you look at, it looks different. And it's going to look different on the NCLEX too. This is why you have to memorize how to look at the rhythm. All right? So, know that each small box is 0.4 seconds in length. See? 1, 2, 3, 4, 5. 5 small boxes make up one big box, and one big box is 0.2 seconds in length. Right? Got that? That's how you find a rhythm. Sometimes the QRS width is 0.12 to 0.20. That's a normal QRS length. What am I talking about? 0.12. That is 3 small boxes, right? 0.4 times 3 is 0.12. So a normal QRS width is 0.12 to 0.20. Right? That's how you figure out the rhythm. All right, let's go to the next slide. So let's take everything we've learned so far and put it together. All right, the slide you see in front of you is one heartbeat. Now, when it comes to atrial fibrillation, ventricular tachycardia, or a stroke, MI, cardiac strip, the P wave will vary. Remember I said look at the P wave? I want you to look at the PR interval. Now, a normal P to R interval is 0.12, which is 3 small boxes, to 0.20, which is one big box. And that's exactly what you see in front of you. You see like approximately one big box from the P to the R. Let's count it. 1 box, 2 box, 3 box, about 4 boxes, right? So this is a normal PR interval. You see what I'm saying? 0.12 is 3 small boxes to 0.20, which is one big box. Good job. Now a normal QRS width, which is what I said to do, look at the P wave, the R wave, and sometimes the S wave. And a normal QRS is 0.08, which is 2 small boxes, to 0.12, which is 3 small boxes. So a normal QRS width is 2 to 3 small boxes. That's exactly what you see in front of you. 1, 2, 3 small boxes. See? Good job. Now, how do we count? This is how you figure out the rhythm. You know, the rhythm. Boom, 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 boom. How do you figure out the rate? Simply all you do is count the peaks or count the R's. Here in this picture, there's only one R, but usually there's more than one R, obviously, of course, right? So with bradycardia, which is less than 60, there might be 3 R's or 6 R's, right? 30 beats per minute. How do you find the rate? You take the number of R's times 10. So if there's 3 peaks, if there's 3 R's, you take 3 times 10, that's 30. If there's 5 R's, if there's 5 peaks, you take 5 times 10, that's 50. If there's 6 R's, 6 peaks, you take 6 times 10, that's 60 beats per minute. And of course, the rate of a normal heartbeat is 70 to 100. There should be 7 R's or 7 peaks to 10 peaks or 10 R's. That is a normal rate. So always look at the P's, the R's, and the S is really what we're looking at. But know the width of the QRS, and know the rhythm, and know the rate. That's all you need to do to identify a strip. It's just that simple. Good job. Now let's go to the next slide. Now, here comes the fun part. Identifying strips is not as hard as you might think it is if you just listen to this PowerPoint presentation or this YouTube video, right? So you only have to know 5 strips, 5 possible strips for the NCLEX, and I hope the NCLEX test writers aren't listening to this. But anyway, here they go. Atrial flutter, atrial fibrillation, ventricular fibrillation, ventricular flutter, ventricular tachycardia, or MI. So what are those 5 strips that we're going to memorize? Atrial flutter, atrial fibrillation, ventricular tachycardia, ventricular fibrillation, and an actual MI. That's what I'm going to cover here today. And of course you have your asystole, which is a flat line, which it won't be that easy. And of course you have your normal heart rhythm, normal sinus uh, rhythm, which will not be that easy. All right. But, so, what is this first picture here? This first picture here is a picture of atrial fibrillation. What did I say to do? I said to pay attention to the P wave, the R waves, the QRS interval, and the rate and the rhythm. Don't worry about the rhythm. I showed you how to count the boxes. Actually, just take a quick look at it. So you can see here with atrial fibrillation, the P waves are non-existent. There's no P wave. You don't see it. The R waves are irregular. Now, what do I mean by that? Well, remember I said that the R wave is the peak. So if we look at the peak, we can pretty much see there's 1, 2, 3, 4, 5 small boxes in between each R, in between each peak, except when we get to the fourth R, there's a longer pause. See that? Count the number of boxes. 1, 2, 3, 4, 5, 6, 7, 8. About 8.5 boxes. So the R waves in atrial fibrillation is irregular. The QRS interval is less than 0.12. Now, each small box is 0.04. So that means that the width of the QRS wave is less than 3 boxes, and that's exactly right. Count the bottom of the Q to RS wave. Count the Q to the S. There's about 2.5, right? 2.5. 2.5, less than 0.12, less than 3 small boxes. And then the rate of atrial fibrillation is 100 to 195. Now, how do we count the rate? We count the peaks, or we count the R's. In this particular example, there's 1, 2, 3, 4, 5, 6, 7, about 8 peaks. This gives it a rate of 8 times 10 is 80. Really, I should have made 2 more peaks to make this correct with what's written. But the rate in atrial fibrillation is 100 to 195. Okay? So, that's how we figure out atrial fibrillation. The P wave is non-existent. The R wave is irregular. We can see that between the length of, when we get to the fourth peak, there's more time, right? The QRS is less than 0.12, and the rate in atrial fibrillation is 100 to 195. So that's how you would find it on the NCLEX. It doesn't matter what the strip looks like if you know your P, R, QRS, and your rate. Simple. So we already learned atrial fibrillation. Now let's go to the next slide. You're doing great. And next we have atrial flutter. Now there's no difference between atrial flutter and atrial fibrillation except that the P waves appear to be sawtooth. I know you learned that in school, right? That's the one thing that teachers, I remember the teacher teaching me that. She forgot to teach me all the other ones. Or maybe I forgot to memorize all the other ones. But anyway, so the P wave is sawtooth, just like atrial fibrillation. Sorry. Unlike atrial fibrillation, the R waves are regular. All right, the R waves are regular. The QRS waves are still narrow, less than 0.12, which by now you know is what? 3 small boxes. Excellent. And then the rate in atrial flutter is 250 to 350 beats per minute. And that's why your P wave looks like a sawtooth, because it's going so fast. The P wave just sits there and flutters. It can't get its beat, right? It just sits there and flutters. So, there you have it. Now you know two strips. You know atrial fibrillation and atrial flutter. The only difference between the two is the P wave, and the R wave is regular as in atrial flutter versus atrial fibrillation, where the R wave is irregular. And the rate is faster. Atrial fibrillation, it was 150 to 195, and atrial flutter, it's 250 to 350. Boom! That's it. Terrific. Let's move on to the next slide. Now, let's move on to the next possible strip that might be on the NCLEX, and that is ventricular tachycardia. Now, look at the strip. What the heck are we looking at? Well, all you got to remember is the P wave is unmeasurable. There is no P wave. The R waves are regular. They're about one small box apart. So if you count R to R, I have like a half a box, 1 box. You know, they're supposed to be 1 box apart, right? So the R waves are regular, 1 small box apart, which means 0.04 seconds apart, right? The QRS waves are wide, greater than 3 boxes, and that's true. Count the Q to the next S, all right? It's about 1, 2, 3, 4, 5 small boxes. Some are 4 small boxes. It doesn't matter. The QRS wave is wider than 3 small boxes, right? So the R wave is regular, the QRS is wider than 3 small boxes, and the rate is always more than 120 or more. So let's count. How many R's are there here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Well, 11 and a half, 12. It's behind my logo. So that's 120 beats per minute. So if you see something that looks like this, the P wave is unmeasurable, the R waves are regular, about 1 small box apart, the QRS waves are greater than 3, and the rate is 120 or more, that's ventricular tachycardia. If it's less than 120, that would be ventricular bradycardia. See, I don't need to go through every single strip. You can kind of use your mind and deduce this, right? All right, so let's move on to the next strip. Good job. Let's keep plugging through here. We're doing great. All right, so strip number 4 that we have to possibly know for the NCLEX is ventricular fibrillation. All right, in ventricular fibrillation, the P wave is unmeasurable, the R wave is unmeasurable, the QRS wave is unmeasurable, and the rate is 120 or more. So, I always tell the students that I tutor, your ventricular fibrillation looks like a straight line that your 5-year-old is trying to draw in the car as you're going over speed bumps. You can't see anything. Alright, just looks like it looks like a squiggly line, just like you see here. Everything is unmeasurable, but the rate is 120 or more beats per minute. And that's ventricular fibrillation. So far we learned atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. And we got one more to learn. That's it. This is exciting. All right, good job, people. Let's keep moving on to the next slide. Okay, now the last strip we gotta memorize for the NCLEX. Dun, 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 dun. Oh, well, it wouldn't be a happy tune like this if it actually happened to you. So maybe that was inappropriate. But myocardial infarction. Let's look at myocardial infarction and how would I explain that? Well, all you got to do for myocardial infarction is look for the S wave. The S wave is extremely prominent. Now, for the purposes of um, the strip that I did here, if you look at the middle heartbeat, the S wave goes down to the line. All right. If you look at the first beat and the third beat, the S wave is past that line. It's all you gotta remember is that the S wave is extremely prominent. That's all you gotta remember. And there you go. That's your myocardial infarction. Myocardial infarction. We're done. S wave is very prominent. You can't tell anything by the P wave, the QRS. The rate. What is the rate? The rate is obviously bradycardia, less than 60 in a myocardial infarction, right? In this particular example I have, let's count the peaks, let's count the R's. We have 1, 2, 3. So here we have a myocardial infarction because the S wave is extremely prominent. The beat is 30 beats per minute, and we're done. If the NCLEX shows you this is a myocardial infarction. Anything less than 60, it can be, if it's less than 60, let's say you have a prominent S wave, but there's 50 beats per minute, that's still an MI. All right, so in closing, just remember that in a myocardial infarction, the beat is less than 60, the S wave is very prominent. In sinus bradycardia, the beat is less than 60. And in tachycardia, the beat is more than 120. I didn't go through and show you the sinus bradycardia, the sinus tachycardia. That's common sense. If it isn't common sense, then go ahead and please ask me when we do our tutoring session. Okay? So that's all there is to know about strips for the NCLEX. Just those 5 strips. Atrial fibrillation, atrial flutter, ventricular fibrillation, ventricular tachycardia, and MI. If you want more tutoring, you can go to my website, or anybody that wants tutoring, let alone more tutoring, go to my website, www.caring4u.net, or you can call 856, the number below. So the contact information and the number is below. There's also going to be a PayPal donation button for those of you who aren't getting tutoring, but hey,